Good morning to our friends in media. Welcome to this morning's Kapihan session with the Department of Health and our invited guests. Today, we are going to discuss World Blood Donation Day. It is my pleasure to be the moderator for this morning. I am Dr. Albert Domingo, the Director of the Communication Office here at the Public Health Services team of the Department of Health. And joining me this morning, I will be giving a more detailed introduction about them when it's their turn already. But just to briefly mention who they are, we are privileged to have Dr. Graham Harrison, who is the officer in charge of the WHO country office in the Philippines. We have Miss Tess Estrella, the program manager of the National Voluntary Blood Services Program of the DOH. And we have Dr. Dennis Ordonia, the head of the Philippine Blood Center. All the three speakers will be giving their brief presentations, and then we will have a question and answer forum at the end, towards the end of the program. We would like to remind our partners in media that only questions related to the topic of World Blood Donation Day will be discussed this morning. Just a quick primer that there's a separate media forum, and I'm sure you are aware that will be happening later this afternoon for all other questions. All right, so just to quickly discuss before passing over to Dr. Harrison, the theme internationally is donating blood is an act of solidarity. It's World Blood Donation Day. We do this every year. We always remind all Filipinos year round, right, Mrs. Estrella? We do it the year round to donate blood. It doesn't only happen during June, June 14, which is the actual World Blood Donation Day anniversary. But let's hear more about what this is all about. Why is blood donation important? What have been the challenges during the time of the pandemic? And now that we are emerging under Alert Level 1 and better times now, over to Dr. Graham Harrison, who I will briefly introduce. Dr. Graham Harrison trained in New Zealand as a public health physician, focusing on health policy and strengthening health systems. He has worked for more than 20 years with the World Health Organization at both the Regional Office for the Western Pacific, which is based here in Manila, as well as in the WHO Country Office in Vietnam, in Malaysia, and most recently here in our country, the Philippines, as both the coordinator for the health systems team and the officer in charge. Ladies and gentlemen, let's welcome Dr. Graham Harrison. Over to you, Dr. Graham.
Thanks very much, Albert, and good morning, everyone. It's a real pleasure to join you this morning. As you know, we're here to talk about the World Blood Donor Day, which is celebrated around the world, usually on the 14th of June. But as was highlighted by Albert's introductory remarks, this isn't just about one day. It's an ongoing process. But we use this day, firstly, as an opportunity to really thank all blood donors who have provided unpaid voluntary blood donations, and their gift has saved lives. But also, we want to remind others that they can also do their part by providing regular unpaid voluntary blood donations. And it's very important that we get a good supply of blood donations so that we can maintain and provide clinical services for people that might need them. This, of course, contributes to universal health care. But there are a lot of different people that might need blood for various reasons. Victims of emergencies or disasters and accidents, women who unfortunately during childbirth have excessive bleeding. We have children suffering from severe anemia, patients with blood and bone marrow disorders. In some cases, these are inherited. So this is a lifelong requirement for some people. And we also have patients undergoing advanced medical and surgical procedures. I think it's important that we remind ourselves that blood donation is an act of solidarity. It's about supporting others in the community. And it's an act of altruism, where you're doing something to benefit others, but not expecting anything personally in return. And finally, WHO uses this day to continue to raise awareness for the need for ongoing investment from governments and others to build a sustainable and resilient national blood system, and the importance of increasing collection from voluntary non-remunerated blood donors. The need for blood is universal, but unfortunately access to safe blood and safe blood products for all those who need it is not. Thanks very much. Back to you, Albert.
Thank you, Dr. Harrison. That is beautifully said. The need for blood is universal. And it is connected to universal healthcare. Beautiful words from our WHO officer in charge in the country office in the Philippines. I just like to remind our friends in the media, if you have any questions, please feel free to type them into the chat box. We will be asking them at the end of the forum. And having heard those words, just to echo what Dr. Graham said, it's a gift that saves lives. It has to be a regular service. There are many people who need blood, many kinds of victims of emergencies, women in childbirth, people with blood conditions, surgical patients, and it's all about altruism, giving something without expecting anything in return. That's my segue to Dr. Marites, to Miss Marites Estrella, our program manager of the National Voluntary Blood Services Program. Ma'am, I always find it hard to say the whole acronym, but I realize the importance now of the V. Why not just call it National Blood Services Program? Why does it have to be National Voluntary Blood Services Program? And connecting from what Dr. Graham said, can you tell us more about how the, let me say it slowly, National Voluntary Blood Services Program in the Philippines, how has the NVBSP been doing so far recently? What have your challenges been? Are there new opportunities with the reopening of the economy and so on? Please, over to you, Ms. Estrella. But before you speak, apologies, I'll just mention your introduction. So, Ms. Estrella is a dedicated public health servant committed in improving rather the health situation in the country, particularly in blood safety. She is an alumnus of the Philomer Christian University, where she attained her nursing degree. She went on to acquire two master's degrees in management, a master's degree in public administration and management at the Philippine Christian University, and a master's in development management from the Asian Institute of Management. Ms. Estrella has been with the Department of Health since 1997. She started as a consultant and held a permanent position in senior level positions in the national offices of the Department of Health. She also became a technical component manager for blood safety. And her public health career specifically has been about blood safety for 20 years, filled with impressive accomplishments, and among them being the forefront public servant in the implementation of RA, Republic Act 7719, or the National Blood Services Act of 1994. Wow. Ms. Estrella, please tell us more about how this Republic Act has been implemented in the Philippines and anything else that the NVBSP has been doing to date. Over to you, ma'am.
All right. Thank you so much, Director Albert Domingo. So please allow me to share the screen, please. All right. Okay, good morning to each and every one of you. And of course, isang malusog na umaga sa ating lahat. Now, I would like to share to you the information about the celebration of the World Blood Donor Day yesterday, and of course, about the National Voluntary Blood Services Program. So as we all know, yesterday, we united together to celebrate the World Blood Donor Day every June 14th of each year. And the theme for this year's campaign is donating blood is an act of solidarity. Okay, so today we are so fortunate and would like to invite everyone that today is our 10th National Blood Summit. So this afternoon we will conduct our National Blood Summit. Next slide, please. The details of which are the following. So we have the program from 12:30 p.m. to 5:30 p.m. So we are so fortunate that we have speakers from the World Health Organizations about WHO Global Action to Save Blood, and then mobilizing the youth from the Philippine Red Cross, and then from Philippine Blood Coordinating Council, Mr. Aristotle Ponsalan. And then we will glad to hear different stories from our implementers down the grounds, from the local government units down to the barangay level. So those were the heart, the true stories to each region that they can share to us. Of course, from the local chief executive itself, Mayor Sivero of Cabanga Kamsur, and then of course from other implementers like from our regional director itself from Region 10, Dr. Liacuna, and then from UPPGH. So there's a lot of stories during disaster, fire, as mentioned during emergency. So this is the stories from PGH during the fire at the hospital itself and how they move forward in providing safe blood supply to their patients every day. And then, of course, stories from Caraga Regional Hospital. Recently, just December, they were devastated by Typhoon Odette. Of course, one of our major source of blood there is the Caraga Regional Hospital in the region, so we can hear stories from there. And then, of course, from the patient side, we have hemophilia patient stories that will be given by Dr. Florida Hernandez. And for our medical practitioners or clinicians, we are glad that we are with Dr. Edwin Rodriguez from the University of Santo Tomas. He is our pediatric hematologist, making blood transfusion effective. So more on about rational or appropriate use of blood, the topic that will be discussed by him. Next slide, please. So for the objective one of this year's celebration is create wider public awareness of the need for regular unpaid blood donation. So to sustain the advocacy, awareness, and public education, we start from, of course, the young ones. So we develop learning materials from elementary for the Bureau of Elementary Education, Bureau of Secondary Education, up to our senior high, and then Bureau of Alternative Learning System. So currently, we are updating the SID learning materials harmonized with the K-12 curriculum. So those were our updates about the learning materials to sustain our advocacy and awareness campaign. Next slide, please. So yesterday, everybody were so happy to see the first time when we had our World Blood Donor Day yesterday is the launching of the MBBSP audiovisual presentation. So we have featured the Facebook blood donation tool for all the youth, targeting the youth populations. And of course, we have also the testimonies from our volunteer blood donors and our patients, the recipients of blood. And of course, also we also advocate that donating blood from repeat regular donors is very important. So we show the facility-based and the mobile blood donation-based voluntary blood donation, and we emphasize that in spite during pandemic or during disasters and other calamities, we are still there, continue our services in getting blood from our volunteer blood donors, and that is our facilities, community-based or facility-based, were safe to donate blood. Next slide, please. So access to our blood donation facilities. So we are so fortunate that we partner with Facebook. So that was started during the pandemic, in CY 2020. So thank you for the Facebook as our partners. So we come up with our Facebook blood donation tool. So through social media, so they just click the application and open the menu and select the blood donations. And then they can see already nearby what are the blood service facilities where or she can donate. And then they can click the schedule where to go and when to go, and they can actually communicate with our blood service facilities. And then the updates, any updates from the blood service facilities, they can also get connected with our donor recruitment officers using this Facebook blood donation tool. So that's our hit for our youth population. Next slide, please. So our mobile blood donations activities from the time of the pandemic since 2020, 2021, and until now, 2022, we didn't stop. And we are so fortunate with the hardships of our blood bank staff to reach to all our potential and volunteer blood donors, to each of the households, and create an initiatives on how with innovations that they can reach the donors and still bring them to our blood service facilities, and even go to the places where our volunteer blood donors are. So continuously, they donate blood to our facility-based mobile blood donation activity. And next slide, please. And of course, we thank you to all men and women in uniforms, and also our media partners, that they don't left us during this time that we have these difficulties. So they are with us. The bayanihan spirit or the duguyanihan spirit are still there, getting stronger, just to save lives for each and everyone all over the country. And we give blood and transport blood from one region and to the other, just to provide access to safe blood supply to our patients. Next slide, please. So for the year starting 2017 to 2021 last year, you notice that from 2017 to 2019, we consistently increased already our blood units collected in the country, and we reached the 1% of the total population, and some regions even reached 2% already. However, during the pandemic, we all know, not only in the Philippines, even in the ASEAN region or globally, we are affected by the COVID-19 pandemic. But as you can see, we are able still to maintain the more than 1 million blood units collected in the country, and slightly increased last year to 1,118,055 blood units collected. And we maximize these blood resources through our regional and interregional blood services network, and maximize this through blood component processing also. And with the help also of our clinicians in the hospital, we work hand in hand how to maximize these blood and blood products to our patients in the hospitals, whether it's government or private hospitals. And of course, together with the Philippine Red Cross and as our partners, blood service facilities from private sectors and local government units. Together, we work to really still involve other partners to reach other regions, especially with the surge of COVID-19. Next slide, please. And of course, we never stop just to look for an adequate supply of blood. It's also, we also give emphasis on the quality and safety of our blood and blood products. So the National Voluntary Blood Services Program, and we are happy to note Dr. Harrison here, the World Health Organization country office provide us technical support in updating these 5 manuals. So we just launched this yesterday, and all our blood service facility staff were so happy that these manuals were now available, and this will be an online training modules that will be taken at the DOH Academy of the Department of Health. So we have the manual on blood donor selection and counseling, quality and process manual for blood center, quality process manual for hospitals, quality and process manual for blood station, and for blood collecting units. Next slide, please. And then, of course, this is for objective number 2 of our World Blood Donor Day. We need to ensure a year-round blood donation to maintain adequate supplies and achieve universal and timely access to safe blood supply. So the DOH and BBSP had an updated Administrative Order 2021-0066, the guidelines on the issuance of Certificate of Inclusion in the Blood Services Network. So all of the hospitals using blood and blood products for transfusion to their patients are part of the network. And we have these SOPs to ensure 24/7 hospitals or blood bank staff, they can access enough blood supply for their patients. And we have our daily blood inventory nationwide to give a light, whether it is a red light, yellow light, or green light for each of the regions. So we work together hand in hand to address issues about access or adequacy of blood supply on hand, real time, every day. So in coordination with our partner blood service facilities. So everybody is part of the blood services network. Next slide, please. And we are so fortunate, started in 2020, of course, during the height of the pandemic. The Secretary of the Department of Interior and Local Government, Secretary Anyo, and of course, Secretary Francisco Duque III signed a joint memorandum to intensify more the advocacy, recruitment, and community mobilization of local voluntary blood donation, and during that time, the convalescent plasma donation program. So with the local government operations officers in the field, and with our local blood program coordinators, together here at the DOH Central Office, we have 24/7 continuous communications just to address the blood needs and access to our blood and blood products and convalescent plasma donation before, during the pandemic. And this time, we are so happy to know that we are here again, much more active, organizing the community-based mobile blood donations. Next slide, please. And with the mandate of the DOH National Blood Services Program for the implementation of the RA 7719, the National Blood Services Act of 1994, and also through the recommendation of the World Health Organizations, not only for the Philippines, but for the other countries. We started, finally, the establishment of our non-hospital-based blood centers. And we are so proud to say that we have this National Blood Center at the top, the Philippine Blood Center, wherein Dr. Dennis Ordonia is currently head of the Philippine Blood Center in Quezon City, Manila. So, and then at the bottom, we have the subnational blood center for Visayas in Cebu. That is the brown paint building. And the one at the bottom with the red, blue, and yellow is one of the regional blood center in Cagayan Valley in Region 2. So we already accomplished 5 in Luzon, 2 in Visayas, and 4 in Mindanao. And we still in progress for the 6 more blood centers to be built in different regions. Next slide, please. Okay, so these are the requirements for our potential blood donors. Of course, he or she must be a healthy individual between ages 18 to 65, weighing at least 50 kilograms with a blood pressure of 90 to 160 systolic and 60 to 100 diastolic, with a hemoglobin at least 125. And of course, the pulse rate is 60 to 100, and definitely a healthy individual. And I'd like to say to each and everyone, before we show to you the 30-seconder glimpse of all our ABPs, maging bayaning totoo, magbigay ng dugo. We will share now to you our ABPs.
Sa paglipas ng mga taon, marami nang ang buhay ang nasagip ng mga blood donation sa buong bansa. Isa si Ira sa mga libu-libong natulungan ng mga blood donations. Siya ay may AML o mas kilala bilang leukemia.
Monthly may taning ka, monthly may infection ka, halos monthly critical yung condition mo.
Maraming blood product yung need ko po. 4 bags ng packed red blood cells and yung platelets 10 bags at habang tumatagal, nag-i-increase yung blood need ko.
Si Kenneth naman, sa edad na 17 years old, ay dinapuan naman ng namamanang sakit na beta thalassemia.
Minsan inaabot po kami sa ospital ng 5 or minsan 10 days na gamutan. Tapos umaabot po kami ng 3 to 4 bags ng dugo.
At sa gitna ng lahat ay ilan sa mga volunteer blood donors na tumutulong sa mga kagaya nila Ira at Kenneth.
Hanggat pwede ako mag-donate, hanggat kaya ng katawan ko, hanggat may dugo na mabibigay, tutuloy ko.
Pero alam mong may natulungan ka at na-extend yung buhay nila dun sa blood na binigay mo.
Bawat blood bag ay katumbas ng 3 tao ang maaaring masagip. Nakapag-donate ka na ba ng dugo? Simulan mo na. Magbigay ng dugo. Sumagip ng buhay.
All right.
Next.
Thank you, Ms. Des. Is there more?
Next
Another one?
ABPs, Dr. Albert, I think we still have around 3.
Okay,
30
go ahead.
seconder. Thank you.
Sige, while our staff are loading the AVP, no, it really feels good to hear that, no, na sumagip ng buhay, save lives while through the donation, the giving of the voluntary donation of giving blood. So how is our second AVP going? And I see that there are already a few questions in the chat box, so our speakers might benefit from having a look already before we go to the Q&A in a bit. So to our host, is the video loading? All right, we seem to be encountering some technical difficulties. Sir Ray, can you let us know if the video is loading? There you go. All right.
Alam namin na marami pa rin ang
nag-aalala dahil
Okay, we're having a bit of an internet connectivity problem. So probably what we'll do probably is let's hear first, no, Miss Tess. We will play the video again. We will come back to it after hearing first from Dr. Ordonia on practical tips. Maybe Dr. Dennis, would you have any like a brief guidance? What's the call to action? If I wanted to donate blood, who am I going to call? What number? Or is there a website? I see there's a Facebook. No, that's a beautiful thing. No, there's a Facebook app. But what if I don't have Facebook and I'm in a province where how can I find my nearest community-based blood donation facility or something like that? Over to you, Dr. Dennis, and then Ms. Tess will come back for the AVP. Dr. Dennis?
Yes, good morning po. Good morning to everyone. Thank you for inviting me for today's activity. So again, no, we would like to request everyone, iniimbitahan namin lahat ng mga individual na mag-donate ng dugo, no? So siguro lalo na medyo um, dumadami yung mga TikTok challenge. Maybe one of our TikTok challenge would be to donate blood at least once in your life, no? So and we would like to let everyone know that the Philippine Blood Center is open every day po, Monday to Sunday, 8 to 5 8 to 3 p.m. Para po sa ating mga magdo-donate. We are located in Quezon Avenue here in Quezon City, just right beside Lung Center and in front of Philippine Children's Medical Center. Very accessible po, no? And if ever you would be needing blood, ito naman po yung ating mga numbers sa ating slide, no? 8995 3846 and the other direct lines. If ever po tayo naman po ay nasa mga probinsya, we have a network called the Philippine National Blood Services or even the Blood Service Facilities Network. So if ever we have patients in Mindanao, in Visayas, or Northern Luzon who would need blood, they can call Philippine Blood Center, and Philippine Blood Center will be the one to call the nearest hospital or the nearest blood service facility in order to be able to provide the blood that they would be needing. So one of the good things about a Philippine Blood Center as a national specialty center for blood services, we all of the blood banks, all of the blood centers, all of the blood services facilities are part of the network of the Philippine Blood Center. So we can easily access each and every hospital to ask and request for blood if needed. So kahit na po sabihin natin ng isang ospital ay nauubusan ng dugo, madali po itong natutulungan ng Philippine Blood Center. At the same time naman din po kung Philippine Blood Center ang mga ngailangan ng dugo, nandiyan naman po yung ating mga regional blood centers and even mga other hospitals para po tumulong sa ating lahat. So muli po, no, inaanyayahan natin lahat ng individual na papasok po sa criteria na pinakita po ni Ma'am Tess Estrella. Inaanyayahan namin lahat at na makilahok sa World Blood Donor Day or mas maganda po ilumahok sa blood donation on a regular basis po. Kami po ay bukas 365 days a year in the entire year. 7 days a week po available po ang ating Philippine Blood Center para po sa ating mga donors at para po sa ating mga pasyente. Maraming salamat po.
Maraming salamat, Dr. Ordonia. No? So tandaan po natin mga kaibigan, no? yung telepono no, na bilang trunk line 8995-3846, direct line 8709-3703 at 8709-3792. Matutulungan po natin ang lahat ng ating mga kababayan na nasa probinsya. Kung kayo man po ay kailangan pa rin ng dugo, ang Philippine Blood Center ang siyang tutulong na sa inyo para mahanap ang lokal na network sa inyo. Siguro, let's play one more AVP and then we can transition to the Q&A. Mindful of the time, 10:46 na po mga kaibigan. Alright, Sir Ray, try lang natin. Tapos kung nahihirapan yung internet natin, we can share from Ms. Tess. Ayan, ito na. Okay. Ay, wala tayong audio, Sir Ray. Baka ano lang po. Sige. Ma'am Tess, can you try to share po from your side? Baka, ayan, teka, may tatry na ulit. Okay.
Every day, thousands of people need blood para sa kanilang medical conditions, procedures, and operations. And this has made donating blood so much easier. This is the Facebook blood donation feature. So how do you use this? You can go to facebook.com/donateblood, or you can just go to your Facebook profile and hanapin ang blood donation feature and sign up. Maging bayaning totoo, magbigay ng dugo.
Yan. And just one last, di ba tatlong video lang? No? So one last video siguro mula kay Miss Che. Pa-share po from your end para makita na natin before we go to the Q&A.
Alam namin na marami pa rin ang nag-aalala dahil sa pandemic. Pero sinisiguro namin sa inyo na safe ang aming mga blood donation facilities. Ligtas po na mag-donate ng dugo kahit ngayong may pandemic. Maging bayaning totoo, magbigay ng dugo.
Sakto, no? Parang napakaganda ng pinakahuling video, Miss Tess, no? And ating mga kasamahan sa National Voluntary Blood Services Program. Kasi dyan ko nakakabit yung isa sa mga naunang tanong, no? So actually the question is directed towards Dr. Harrison, but Dr. Graham, so the last video was saying in Filipino that it's safe to donate blood, even in the time of right now that we're exiting. We're still in the pandemic, but we're exiting. So how safe it is? I'm just going to read the question. No, the question from is here. This is from Red Mendoza of the Manila Times. Dr. Harrison, is there any guidance from the WHO regarding blood donation among recovering COVID patients? And can we also make a clarification that donating blood does not transmit COVID-19? Over to you, Dr. Graham Harrison.
Thanks very much, and thanks for the question. I think it's important to realize that it's not just about COVID, and I know that's on everybody's mind at the moment, but anybody who donates blood needs to be fit and healthy and not suffering from any diseases and that they know of, particularly colds or anything else. So basically, when you're doing donation, there will be some screening questions that will be asked by the team that are taking your donation to make sure that you're not likely to have any infectious diseases that might be a problem. I mean, they'll discuss those with you, but in general, after you have recovered from COVID infection, then it's okay to donate blood. But of course, this is 10 days, a couple of weeks after the symptoms have gone. You shouldn't try and do this for not just for COVID, but in any situation where you're feeling unwell in that. It's just put it off for a while until you've recovered from whatever you might have. But I'm sure that Dr. Ordonez may elaborate a bit on how this is being applied specifically in the Philippines setting when people come in. But just to relate to also to vaccination, I mean, the usual vaccines that are used for the COVID vaccination, AstraZeneca, Janssen, Moderna, Pfizer, and that are all inactivated vaccines. So they don't transmit COVID-19 to anyone else and that as well. So it's quite safe after you've been vaccinated. But if you are feeling unwell, then indeed you should put that off until you're feeling better. I mean, principally, COVID is not like some other diseases that are more transmitted by the blood, because the COVID transmission is primarily respiratory related and that. So it's a bit different from some others where different considerations may need to be given as to whether or not you can donate blood. Thanks.
Thanks, Dr. Harrison. That's my segue to ask Dr. Dennis Ordoña with a follow-up question related to what Dr. Graham said. So, can a patient still give blood even if the patient has underlying health conditions like diabetes and other comorbidities? So, when would you advise that blood donations are not advisable? So, can you still give blood if you have comorbidities like hypertension and diabetes? And when should you not donate, if ever?
That's correct. Again, thank you, Sir Graham. I'd just like to add that I do agree 100% that you can donate blood even if you have underlying conditions as long as they are controlled. So, for example, if you have hypertension or diabetes, you can still donate blood as long as you are on medications, and if your blood parameters are controlled, your blood pressures are controlled, you can still donate. And of course, you cannot donate if you are the one needing the blood. So thalassemia patients, cancer patients, of course, these are the people that we do not want donating because they primarily are the ones needing the blood. So, and if ever you have prior histories of blood diseases, blood transmissible diseases, no, so that's one thing that we have to prevent from donating. For example, hepatitis B, syphilis, HIV. These are the donors that we cannot allow to donate, primarily because it's transmissible through blood. Unlike COVID, which is primarily respiratory, COVID recovered patients may donate anytime, but COVID recovering, currently recovering, I also do advise to wait until they are fully recovered.
Great, no? Maraming salamat, Dr. Ordoña. I-emphasize ko lang, no? So, mga kababayan, pwede palang mag-donate kahit ikaw ay may high blood, may diabetes, or may ibang kondisyon. Basta ikaw ay controlled ang kondisyon at kaya kahit kumukuha ka ng maintenance, no? Pwede, Dr. Ordoña. Tapos yung paglilinaw na pag ikaw ay gumaling na mula sa COVID, pwede po mag-donate. Ang COVID lang na hindi pa pwede mag-donate ay kung ikaw ay naka-isolate pa at gumagaling, hindi pa natapos yung isolation. Wag muna, antayin nating matapos yung ating, makompleto yung ating isolation bago tayo mag-donate. At dahil nasa usapang COVID na rin tayo at talagang hindi natin maiwasan na mabanggit yan, meron tayong tanong dito, Ms. Tess, mula uli kay Red Mendoza ng Manila Times. How was the National Voluntary Blood Services Program able to adjust during the first 2 years? Sana Red, no, sana last 2 years na rin yun. Pero syempre yung sinasabi lang nila is from 2020 up to 2022 at the height of the pandemic, how was the NVBSP able to adjust with the conditions of the COVID-19 pandemic? And how are we assuring that the blood donations that the NVBSP is receiving are safe? Over to you, Ma'am Tess.
All right, so thank you so much for that question. Of course, the safest source of blood is an honest, regular repeat, and responsible volunteer blood donors. They are the #1 safest source of blood. Of course, they are healthy individuals. And how does NBBSP or all our blood service facilities nationwide adjust for the first 2 years? Of course, on the first year, during the surge of COVID-19, everybody, and of course, again, the management of the Department of Health issued out very quickly, promptly, all the guidelines and policies that will be followed by all our implementers on the ground. In terms of access of all volunteer blood donors because of the limitation of the transportation, lockdowns, fears, etc. So again, we had on the first surge a partner with our Department of Interior and Local Government to heighten how we can adjust for the new normal of donating blood during COVID-19. And we also have this traffic light surge plan for all the blood service facilities. So it's a surge plan that will be activated once there will be an announcement and in that area that there is a surge of COVID-19. And our airline operators are also volunteering to provide blood and blood products, because not right away during the surge of the pandemic, all the regions are on the level of surge. It's a different level on each region. So where there is no surge, actually, we increase and intensify more the collection of blood to help those regions wherein the surge are in. So we transport blood through our volunteer airline operators, Philippine Airlines, Cebu Pacific, PAL Express, etc., to transport blood from one region to the other, just to augment the blood resources, because the mobilization is really a challenge to all of us. And we even have transportation for all our potential volunteer blood donors to pick them up and brought them individually to our blood service facilities to donate blood. So we also calibrate, recalibrate, and change also in terms of how the pandemic or COVID-19 situation we are in. So through our policies and the surge plan and with our technical working group, we are promptly aware that in times of pandemic or emerging and re-emerging infections, calamities, and disasters, we are activating those kind of core group to plan and then immediately transmit to all our blood service facilities nationwide, all our guidelines and policies to be in place. And
Thank you.
you can see, Dr. Domingo, and our statistics, we actually increased already the blood collection and much more this year in CY 2022.
Thank you, Ma'am Tess. No? Napakaganda nung sinabi that mo na. That's a very interesting thing that I heard, that whenever there is an increase in cases in a particular area, COVID-19 cases, and there might be some restrictions on blood donors, other regions or other areas where there is not an increase, no increase in cases, they can actually fly in. No? Did I hear that right? Linilipad yung dugo mula sa mga region na hindi naman ganun kataas yung alert level. Tapos parang area parang delivery na special delivery kasi talaga naman alam natin that blood saves lives. So that's a very good point. And I will just, in the interest of time, it's 11 o'clock. We just have one remaining question. But I just wanted to prompt the speakers that after I ask this question, I will be turning over to each one of you for a few closing remarks before we close the session. And actually, speaking of flying in blood from other regions, it's a perfect connection to this question. Red Mendoza of the Manila Times is asking again, and I'm going to direct the question to Dr. Dennis Ordoña, and maybe Ma'am Tess also can provide an answer. Beginning with Dr. Ordoña, sir, how is the supply of our blood in our government blood banks? Is it still enough for our needs despite the ongoing pandemic? Dr. Ordoña, and then Mrs. Jelia.
Yes, Dr. Albert, saktong-sakto po yung sabi niyo. Sa ngayon po, talaga pong dumadanak ng dugo ang Philippine Blood Center. Just from over the weekend and until yesterday, I think we have gathered around 600 plus donors in just one weekend. We had one event for 100 blood donors last Saturday. Yesterday, we were expecting 100 and we got around 200 plus donors. So sa ngayon po, marami po ang dugo. But of course, the demand for the blood does not decrease. So it's not an indication for us to stop. It's actually an indication for us to continue and promote voluntary blood donation. Thank you.
Thank you, Dr. Ordonia. No? Ito yung mga pagkakataon na napakaganda ng bayanihan, no? The solidarity. So we're saying it in Filipino, Dr. Graham. The bayanihan, which is the equivalent, which allows us to give an opportunity to thank our kababayans for actually responding to the call. But as mentioned by Dr. Ordonia, it is not only during the World Blood Donation Day period that we should give, but let's do it year-round. Ma'am Tess, can you also give a few answers to how we are assuring that we are doing this year-round? Just to emphasize na pandemic man o wala, mapa-donation anniversary man o hindi, tuloy pa rin. Ano masasabi natin, Ma'am Tess?
Yes, we are so thankful, of course, to all our potential blood donors or volunteer blood donors. They are all excited, actually, especially in this CY 2022, that physically they see each other during our mobile blood donation activities in the community. So we rest assured the public and our blood service facilities that we actually increasing this year our blood collection and increasing the number of kabalikat partners. Talagang tumatawag sila, no? Reach out to all our blood service facilities. And with a joint memo circular, all our local government officials are calling our blood service facilities for the all year round. It's not only for a special events or activities, all year round mobile blood donation activities. And we, the DOH and BBSP provide resources actually to still continuously collect blood to all our facility-based or community-based mobile blood donation. And through our blood services network, Dr. Albert, we ensure that access to blood supply will be acted upon here in our country, the Philippines. Thank you.
Thank you, Ma'am Tess. Beautiful answer question. And I just wanted now to turn over to the three of you, starting with Dr. Graham Harrison. Any last words or remarks before we close this morning's Kapihan session on the World Blood Donation Day 2022? Dr. Harrison.
Thanks very much, Albert. Just to reiterate really our key messages today, that providing regular unpaid voluntary blood donations saves the lives of others. It is an act of solidarity. And my experience is that's part of what's in Filipinos' hearts. And so I think it's one way of demonstrating how you can support your community. So please do so, as we say, not just today, but on an ongoing basis. Thanks very much.
Thank you, Graham. And Dr. Dennis Ordonia, any last words, remarks, call to action? Over to you.
Again, we would like to invite everyone, no, patuloy po na mag-donate, no. Kami po ay nagpapasalamat sa lahat ng mga individual na nagdo-donate at patuloy pang magdo-donate, no, dahil ito po talaga ay isang direktang aksyon kung saan nakakatulong po ito sa ating mga pasyente na nangangailangan. Muli po, kami po ay taus-pusong nagpapasalamat sa lahat ng mga donors para po sa ating mga kababayan. Thank you very much.
Thank you, Dr. Ordonia. And last but definitely not the least, Ms. Tess Australia from the NVBSP. Over to you, ma'am. Last words po.
Okay, so to all of you, in behalf of DOH National Voluntary Blood Services Program, taus-puso po kaming nagpapasalamat sa inyo. To all our volunteer blood donors, maraming salamat po sa pagsagip ng buhay ng ating mga pasyente sa hospital. Ipagpatuloy po natin ang duguyanihan spirit na tayong lahat ay magsagip ng buhay. Ang solidarity po ay isang pagbubuklod natin sa bawat isa tungo sa ligtas at sapat na dugo para sa ating mga pasyente at mga kapatid. Maraming salamat po sa inyong lahat. Sa muli, ipagpatuloy po natin ating duguyanihan, maging bayaning totoo po tayo at magbigay ng dugo.
Thank you, Ma'am Tess. Ang ganda ng sinabi mo, no? And just before we close, we would like to thank all of our partners in media. One of the key messages I noticed is even if we cannot, if someone cannot directly donate blood, the fact that you spread awareness about blood donation means you're also part of the solidarity. When you spread the right information, when you spread the call to action for people to donate blood voluntarily, you're also part. And this is my way of saying as communication director, maraming salamat sa ating mga partners in media for attending this morning and for asking the questions. Thank you so much, Red, and all of the colleagues. And we hope that you could help us spread the message for blood donation so that we can keep this going on, not just during World Blood Donation Day, but year-round. Maraming salamat po. Thank you to everyone, to our speakers, Dr. Graham Harrison, Ms. Tess Estrella, and Dr. Dennis Cardona, and to our friends in media. This is your Communication Director or DOH, Dr. Albert Domingo, signing off. Media, please join us again later at 1 o'clock for the Media Forum with Undersecretary Rosette Vergeire. Salamat po and good morning. Thank you, Graham. Thank you.